Okay.
I just have to share it out at first. So that takes a couple of seconds
No worries.
once it goes live. Okay, so we are live now, but it just takes me a second to share it out. So let me lower this. And then if you go on YouTube, you can actually see some of the comments, but I just want them to bear with me right now because I'm gonna share out the video to our social networks. So just bear with me 1 second while I do this. I just like to put Tier Talk is live now. So hold on, just takes a two seconds. Hope everything is well.
Yes, I'm good over here. I've not been outside for a couple of days.
Respecting the rules.
I'm respecting the rules, trying to flatten the curve.
It's gonna happen. These next couple of weeks are gonna be tough though.
Yeah.
I saw that New York's numbers are kind of going down.
They're kind of leveling out. I don't know that they're necessarily going down because I was looking at the confirmed cases.
Oh, really?
Yeah, the confirmed cases. I decided to kind of just look at the stats of just in general what's happening.
Okay, just gotta share it out on Facebook real quick, and then we'll be good to go.
Sure.
Well, guys, just bear with me, guys. Just sharing it out on social media. I know we have people coming into the room, but I'm gonna share it out on social media real quick. I just want to get it on our Facebook accounts. Okay, hold on. I do have allergies right now, guys. It is allergies, so bear with me. Okay, so hold on, just a few more groups. Gives people a chance to come into the room too. Got a few updates. I want to talk about the numbers at Rikers, which is oh my God. The numbers at Rikers is ridiculous.
Yep.
Let's see.
Were you able to get more like real-time numbers or just what?
Yeah, I got numbers as of today.
Okay,
Well,
good.
I'm sure it's gonna be up by tomorrow, but at least I got some numbers for today. And also, guys, before we start, I just want to say, because I'm not able to put my sponsors in at this time, I just want to read off, a little bit about my two sponsors. So we have the American Military University. That's an online college. Discover how our award-winning education can help you reach your next level. Apply now. AMU offers 200 plus online degrees and certificates, both undergraduates and graduate programs, 8 and 16-week courses, monthly starts, flexible schedule, affordable tuition. Guys, they have been with me since day one, going back 5 years minimum. And one last thing, in case you guys are looking for any updated information on the coronavirus, because one of my sponsors is Lexipol, which is Corrections One and Police One. During the crisis, officers can access online coronavirus-related courses and policies for corrections, probation, and parole at no cost. Access is available for individual correctional officers and facility administrators nationwide. To learn more, coronavirus.lexipol.com. That's coronavirus.lexipol.com. Lexipol is the leading content policy and training platform for public safety and local government. Okay, so we got the formalities out of the way. Connie, thank you for staying up a little late. I know this is past your bedtime.
Yes.
But what I'm trying to do as best we can is try to do updates, just to kind of let people know what the numbers are and just to try to keep people up to date. We do have some people coming into the room. Hey, what's up, Thorfinn? And we also have Jose. Doran's first question, what are your thoughts on scaling back on punishments such as lock-in due to leaving cell doors open or not wearing full uniform due to mental health being in jeopardy due to no contact visitations? All right, let's get to that, Thorfinn, because we may have to reword that question too.
Yeah, that's a big one. That's a lot of emotion with that.
Yeah, remember, we're just simple correctional staff. So, maybe we could break that down a little bit. But all right, guys, so we do have some updates. I want to give it out real quick. First off, we have Connie. Connie, welcome again. Connie, do you mind giving some background on who you are?
Sure. So I'm Connie Alleyne. I'm the founder and president of the Civilian Corrections Academy. Essentially, we support civilian learning and development through different phases of their career. And so that's the fun stuff. but I have my master's in public health. So all of this goodness that goes on or is going on with COVID in the facilities has definitely had me in more of a state of awareness and trying not to be in a panic, because you kind of understand what this means in the environment, the broader medical implications, I would say. And outside of that, like I'm here. I'm doing my best to be supportive and to be a resource.
Well, you're a resource and you're always supportive. And I would like to dedicate this episode to a good friend of mine. She was a nurse at the facility where I work. Unfortunately, she was taken by COVID. Her name was Susan Sakala. You guys could see a picture of her. Let me see if I can get away from the light. But she was a wonderful woman, dedicated to the mission. She made the ultimate sacrifice. But I want you to know that obviously she's a hero and she deserves recognition, just like all our other frontline staff members. Susan Sakala, thank you for your service. Thank you for your dedication. It's just sad. Our facility's taking this one hard. But again, she would want us to move on and beat this thing. And Connie, just before we start, if there are people still out there that are not taking this serious and still thinking it's a joke, what would you say to them?
I would just say we're at a point in the United States where we're at over 347,000 confirmed cases. As of today, there were 9,931 confirmed cases. There are now 10,335 deaths. Today alone, there were 716. So for those of you who are still doubting whether or not this is real, people are losing their lives. And so the more that we do our part in flattening the curve, the better it will be that we'll start to see more of these recovery cases. As of today, we've got 18,953 recovery cases, and that's throughout the United States. But, simply put, we all have to do our part in order to make that happen. If you can stay indoors, you should be.
Right. And as I follow the news, I know I keep on going back to Rikers Island. Rikers Island is obviously the facility that's most affected. And what I'm looking for is to basically see when their numbers start to go down. Because again, that's where, to me, it kind of started, where it escalated. And Rikers Island did just lose their first inmate towards COVID. He was a 53-year-old male. A Rikers Island inmate died Sunday from COVID-19 complications. The New York Post reported that 53-year-old male inmate was transferred to a local hospital on March 26, where he later died. The inmate's death marks the state's first COVID-19 prisoner fatality. Our deepest condolences go out to the detainee's family in their time of grief. That comes from Peter Thorne, who's the Department of Corrections spokesperson. The safety and well-being of those in our custody remains our number one priority. And as of now, now this is as of Sunday, at least 321 correctional members and 273 inmates had tested positive for COVID-19. But hold on a second, guys, because actually that's from Corrections 1. I actually got another number today for Monday, and I want to give that to you because now this number to me, this is only in one day, again, from Sunday to Monday. So I want to just give you that last number. I think it's right here. I think at this point, the number jumped to, I don't want to say it unless I can confirm it. No, let's stick with that number for now because this is the most recent article. So as of Monday morning, 333 employees with the New York Department of Corrections have tested positive. And then while in custody, 286 inmates in New York Department of Correction facilities have also tested positive. I'm going to try to.
Do you know if that's New York State or New York City?
No, that's New York City.
Oh,
that's Rikers. Oh, sorry, you're 100% correct. No, wait, hold on. You're right. It's the you're 100% correct. It's inmates in the New York Department of Corrections. It's how they're wording it, and the reason why it's confusing to me is the city is not attached to the state. So when I see it talking about Rikers and then they jump to the state, hey, that was a good call on you, Connie. Thank you. Thank you for correcting me live.
Listen, I'm trying to make sure they get all the right information.
No,
And
no, you're right. You're right.
No one's coming back at you being like, Gangi, you gave out the wrong stuff. That wasn't right.
No, you're 100% correct. But again, still high numbers. That's across the state of New York. And if you guys notice, we discussed this a little bit yesterday. Elias Hussam Medina is really leading the ways in doing what he can to protect officers, staff, and then also trying to help out the inmates as well by making sure that they get masks, PPE equipment. Because guys, we don't want this to spread. You know, we're dealing with human life. So as much as people think we're barbaric, we're not. You know, everything we're doing right now is to ensure that the population don't get affected. We protect ourselves. We also protect the population. Also, I was reading something earlier today. Jay-Z and Meek Mills, the rappers, they have a criminal justice platform called Reform Alliance, and they're sending about 100,000 masks to correctional facilities across the country. 50,000 masks are being sent to Rikers Island Jail Complex, and another 2,500 masks are being sent to Rikers Medical Facility. And then you have an estimated 40,000 masks are being delivered to the Tennessee Department of Corrections, and another 5,000 will be sent to the Mississippi State Penitentiary. And then also inmates with the Tennessee Department of Corrections have been working in the textile plant and MCCX, making protective face masks for medical staff across the state. Hey, Connie, let me ask you a question. Maybe you can help me with this, because a friend of mine, I'm going to try to put her on the channel in the next couple of days. Her name is Shelly Addison. She actually been making masks, and she gave me a lot of tips on to make sure that if you're making this at home, what the do's and the don't, the type of fabrics that can be used, you know, a bunch of different things. And I was wondering, you know, if someone, you know, if we don't have the equipment, do you know of something that we could do around the house that we could wear around our face, the things that we need to look for, like maybe the type of cloth that we use? Or
So I saw a couple of videos. One video that really sticks out to me is someone had taken like a cotton t-shirt. They cut about 7 inches wide, and they folded it on both ends and sort of created their own mask. But what happened was you have 2 layers of the t-shirt, and then you have, when you fold the flaps over to put the rubber bands in to put around your ears, it gives you an additional 4 layers of material. And so when you think of that, I think that does a pretty decent job in keeping you nice and secure when you're at home. And that was actually one of the recommendations that came from the CDC, that we start to kind of make these that we make these masks because the ones that are the surgical ones are really needed in the field.
I actually muted because I know I want to make sure, because I do have allergy, guys. I'm quarantined myself in the basement right now, so I'm trying my best to deal with the mold. You know what's funny is you didn't hear me sneeze, but you saw the movement. Is that what it was? Oh, well done. And then all right, so hey, Joe Baca says something great. He saw a special on inmates with a phone taking videos of the panic in prisons. You know what's sad, guys, and we discussed this before, and I'll also maybe quote back some old articles here, but we really need to get a hold of what's being put out there and what's being shown to the population as well as our staff, because the last thing we want is hysteria. So I know that there's a fear right now, but I also know that we're starting to get a gist of what we need to do. You got to realize that when this first started, you know, we're social creatures. So we're in a habit of wanting to hold people, wanting to interact. And now as it progresses, we're catching ourselves. We're basically starting to become conditioned to that social distancing. So I think that's another part that's going to start to help drop the numbers, because now we're catching ourselves more than ever. I mean, I see people now that when they go to talk to you, they make sure that they stay 6 feet away, where, you know, a couple of weeks ago that wasn't happening because it was new to us. But I think, Connie, you would agree right now people are starting to
get Absolutely. I mean, and it's happening everywhere. I mean, you go into work, it's happening. You go into the grocery store, it's happening. I catch myself. The other day I had to run in to go get something for my daughter. And I was like, if someone was in the aisle, I didn't go in the aisle. It's like, how do you really maintain that social distance from folks? Because you just don't know. And I think what's even more scary is that there's more people who've come up being positive that have been asymptomatic. And so the scary part is, like, if you have nothing that even triggers you to think you were exposed or you could be carrying and exposing other people, like, you just don't know.
That's the scary thing. The fact is that you don't know. Ohio is being hit now. They got 10 inmates and 27 staff that's infected. This article's from April 6th. Governor Mike DeWine announced Monday that the state may release some prisoners in response to the spread of the coronavirus. 5 prisoners in the Marion Correctional Institution and 5 at the Pickaway Correctional Institution. Both state prisons have tested positive for the virus. In addition, 27 state prison staff have tested positive for the virus, with most of them being from Marion, according to the governor. DeWine said prisoners who will be under consideration for release because of the virus include those who are serving time for a nonviolent offense and those who might be getting close to release date anyway. The state will release more detailed information. Hey guys, you know what I've been noticing too? And Connie, tell me if this is a good idea. If your state has a hot spot where the biggest numbers are, like in this case here, I believe they said Marion, and I guess obviously in New York it was Rikers. You may want to keep the inmates that are affected or positive still within that facility. Keep that within the hotspot and don't be transporting inmates out to another facility. You may want to, if you can, wherever that hotspot is, that may be where you want to have your isolation, your quarantine areas, because if not, what's going to happen is that you're going to start bringing those inmates into other areas where it's not as hot, not as affected, and now you're kind of spreading out your resources. That was a problem in New York State when they were taking a lot of inmates from Rikers, again, in a rush to release inmates. And of course, it looks like it's a great idea at first. I'm not 100% with that because, we're scrambling right now at the prison level. I'm hoping that they can handle their stuff at a county level. But again, with that said, you're taking the inmates out of the city, which is a hot spot, and you're bringing them all the way up north. And then you start seeing north, their numbers are growing, but they don't have the resources. So Connie, would you believe now it's a good idea that if you're in that city where the hot spot is, or in that location where the hot spot is, maybe you should leave the inmates and staff there and hopefully maybe find a way to do the isolation and quarantine within that hot spot?
I absolutely agree with that. I mean, that's the last thing. You definitely don't want to start moving offenders or employees around, because you do then open up the ability or the likelihood of that virus being spread other places. I think one of the things that I think is a good idea is when there is, someone identified, that if there is a space where you can create that hot zone where then you can have more focused resources in one area, that's much better than you pulling people out and now you have to try to find coverage in all these different spaces.
Yeah, I agree. I think when this first started happening, guys, we could learn from what's happening in other states or other facilities, is that we were looking to kind of set up whatever we could as a quarantine area when we should be trying to keep that quarantine area localized wherever that hotspot is. And also, I want to comment on something that Jose Baca said. Do we stop doing the job or do it even better? I think we have to be safe, but now is the time to show more confidence so as to not to have a panic. And I agree, guys. Let me tell you something, guys. We're in the midst of a scramble right now. We are, because we're kind of we've never been through this before. It's novel to us. We're trying to figure out things as we go, but we have to trust in our people and trust to know that we're going to get through this. And even though we're scrambling, we have a destination. That's the key. We always have to show that we know where we want to go. We'll figure it out along the way, and that's where the scramble is. But we know that the end result has to be here. And if we don't show that we're confident, especially, it starts from the highest level. If the highest level is not confident, it's not going to translate well to the lower level, and then from the lower level to the inmate population. And with the news saying what it's saying, and basically kind of causing this pandemonium, we need to really exert that confidence so the inmates can see and the staff can see that, well, wait a second, this can't be true, because obviously we have staff here that's able to, handle this concern, able to put some level of control. But if we're not being confident, if we're panicked and we're, kind of dealing with anxiety, well, the problem is that we're not going to be able to maintain control because we can't maintain control of ourselves. What's your thoughts on that, Connie?
I think the other side of that though is that when they start questioning confidence, they also question competence. And you don't want that to be the case in any situation where you've got outsiders coming in thinking that we can't handle what's going on in the facilities. Is it beyond, is it like in one of those extraordinary situations? Absolutely. But I also know that we do have the competence to understand what the right direction is. We understand who the chain, what the chain of command is, and like what our next steps are going to be. And granted, it's an evolving situation. And so from day to day, that might change. But I think as long as that the staff are getting like clear direction on what's the path forward, that we can get through this.
And even guys, I want to make sure that people know that even though we're going through this coronavirus, inmates are still attacking staff. We South Carolina, Lee Correctional Institution, April 2nd, officer was stabbed by an inmate, was seriously injured. According to a tweet from the Department of Corrections, the officer was stabbed at a living unit at Lee Correctional on Thursday, April 2nd. He was taken to a local hospital and hopefully is beginning to recover at home. But again, the dangers are still there. Even though we have this pandemic, we still have to maintain our focus on that we're in an environment that also contains a lot of threats. And the coronavirus is just a threat we can't see. But we still have other threats that we have to deal with, even across this mayhem. And right now, I also find out that a lot of inmates are trying to utilize the coronavirus to manipulate their release as well. So like once you start pushing this nationally, this thing to start moving inmates out because of health concerns and all this other stuff, which granted, I'm sure on a case by case basis, it's needed. I'm not 100% against it. I'm not saying that. But people have to realize that now you're going to have people coming out of the woodwork that once you do for one, there's going to be a push to do it for the many. And then we start getting overwhelmed with answering those concerns or those complaints. So now you have inmates that are taking the good and they're trying to make it into their own benefit. And you know what's funny, Connie, someone like you who's in the business, I know that you have a very good objective perspective where you actually know, okay, this is good on the surface, but then the back of your mind, like, oh, but watch how the inmates are going to misuse this. And you can see that. You can see that happening, right? Inmates trying to manipulate.
Absolutely. I mean, come on. I mean, how you gonna let my cellie out but I'm still here? You know, we shared the same room. I probably got what he got. You know, like it's you can see it building. You can see, oh, I was exposed. Or I think the other thing that we would want to be mindful of is, so you'll have these offenders who are talking to their family and sort of inflating the situation to their family. And then you got, you know, administration getting pressure from families who are calling in because, you know, their loved one has painted this very horrid picture about what's going on.
And you know, you could still see that fight. I mean, I like to think that it's lessening a little bit, but you still have areas that are not allowing the officers to have any form of PPE, you know, especially the face mask. Let me ask a question, Connie, from your medical perspective. When is it necessary for the N95 and when is it okay just to wear the surgical mask?
Now, what I've seen lately, it's been that the N95 is probably the way to go. That's what I've been seeing in most of the press releases and most of the discussions about how do we make sure that we're protecting ourselves. Now, I think, so the way I understand it is that with the regular surgical mask, if there's like a big splash, like then you wouldn't get that splash it wouldn't necessarily penetrate the mask. But when you have something like coronavirus that's kind of in the air and the particles may not be as big as the droplets from a sneeze, right? Then you could be susceptible to exposure. And so the latest that I've seen was N95 is the best way to protect yourself. But then what I've also seen is people kind of doubling up on the surgical mask to get an extra layer. But I think the surgical mask also doesn't fit as tightly. It doesn't seal the same around your nose and mouth. And so I think that's why many people are preferring the N95 than a normal surgical mask.
And you know what? Obviously, Exefio agrees with you 100%. He says N95s are better and always been preferred, but it seems like the N95s are harder to get. I don't,
Yeah.
you know, obviously they're a little bit more complex to make. I see that there are a lot of people getting them in stock, but you have to order them by bulk. So like the more you order, it brings the cost down of the individual
Hmm.
making of the mask. Like if you order 1,000, it brings the mask down to about $4.99 or $5. So you have to at least come up with $5,000 to pay for at least 1,000 masks. But you see a lot of unions stepping up.
Yeah.
If they feel that the department's not doing it, they're stepping up and they're buying the masks for their staff. And obviously, that's definitely needed. You saw that in New York. They bought like
Yeah.
5,000 masks.
I mean, your union dues got to be good for something. I'm just saying. Come on.
Um, yeah, Tim says, get the old sick who can't harm out. The people doing years for nonviolent reoffense marijuana charges out. They'll be back if they need to be. No reason for overpopulation anywhere. Yeah, you know what's funny? I saw what was happening in Alabama. Alabama, they're down staffed. Alabama's severely understaffed. And that's just years of just not giving the right incentives, just not really taking care of their employees. And, and again, that's from what I read. And that's from the people I know. Now they're losing staff, or they have the potential to lose a lot more staff with this coronavirus. So you have a facility that's already in need of like National Guard or some.
Already hurting.
Yeah, they're already hurting. So the thing is that, we're, obviously states that had the proper staff, which is rare nowadays. A lot of facilities are understaffed. They're getting to the point where they're kind of using, they're splitting the shifts from like 3 shifts to 2 shifts, but you have some facilities down south that's already done that prior to this coronavirus.
Yeah, I mean, so I was reading about there's something called augmentation, which I've not known that. And
Federal
so
government does that.
yeah, and I was like, so you got civilian staff who are functioning in security roles who like it seems to clearly it's an extraordinary measure to take. And so it's absolutely needs to get done if that's what's being done. But I just think, suppose now you have the cook at the cell door, like how do we make ourselves more vulnerable as an institution or as an organization by kind of taking on those measures? I think, yes, there are times. So for example, when we went through Hurricane Sandy, for some reason, when the power went out, like cell doors popped. And of course, that was like, holy, right? And so that was a time though where like they called for medical, they called for like who all hands on deck, because we need to make sure this is, contained and everyone's where they need to be so people don't get hurt and things don't get out of control. But like that's like a one-time situation, almost like a fluke of nature, right? As opposed to you running your facility low on staff to begin with, probably no fault of the administration either, because you have to think, in order for you to incentivize people for these jobs, there's got to be a certain amount of competitive offering out there. And if you simply don't have it in your state, you just don't have it. But it's definitely a hard thing to do when you see that the facilities are already running low. Then you have the virus taking more people out, and then you start augmenting the staffing, which is crazy.
Yeah, so basically, just to comment a little bit about the FBOP, the civilians, except I believe religious services, they're all trained as officers. But my concern with that, because I remember having an episode on this already, my concern with that is, but you're not doing it every day.
Right.
So I mean, but again, I don't want to negate the fact that they do have that level of training, but in my mind, they may not, I don't want to say experience, but they're not conditioned, I guess. I mean, that's something that you get every day. So what I was thinking of, and this to me, and we mention on every show, so I'm going to kind of keep on reminding it right now, is that we should literally have these facilities locked down by now. You know what I mean? Just to kind of control what's coming in, and also limit staffing, keep staffing consistent, have a team A, have a team B, and then pay for team A to stay somewhere like under a quarantine. So when they go in the facility, they can't go home. So like, if you're going to work with us, we'll pay you, we'll pay for that hours of sleep. We'll give you whatever you need to do. We need to make sure we give you the right incentive. But with that said, while you're here for as long as this goes on, you cannot go home. Your life is going to be the prison and wherever it is that you have to sleep and then back. And some people are willing to do it. If you give these heroes enough incentive, they'll step up and do it. But to me, that's the
Absolutely.
only way it's going to kind of level out the numbers. Would you agree? I would say the same thing with medical.
I actually do. I mean, I'm just reading this article. So Vermont, early Monday, they released a statement that they had another staff member at the prison showing up with COVID-19 symptoms. Monday, the department issued a second statement saying that the staff member has since tested positive. This is crazy. And so they actually decided to go in a full lockdown. Just that. And so, my experience with a lockdown is once I'm in, I'm in.
Yeah, but you know what though? They're I agree, but at least they're at that level where they're still doing it. Like there are still levels, it's like I was reading one, I think it was Northampton. I think it's Massachusetts that once 2 officers were tested positive, lock it down. Federal government, supposedly they've been locked down for quite some time.
Yeah, they've been locked down for like 2 or 3 weeks now.
Yeah, someone even said maybe even sooner than that, but that's all 122 facilities. They know that there's a threat. They're locking it down. But they're still allowing phone calls and stuff, which is good. They're still allowing that interaction. Hey, remember when there's an article about Alabama real quick. It says, remember we discussed this briefly? Alabama prison system COVID-19 plan anticipates widespread infection and death. A 263-page document says the design of the state prison, overcrowding and understaffing makes it impossible to keep COs and inmates safe from COVID-19. But check out the numbers, though. This is what they're predicting in the worst case scenario. In the worst case scenario outlined in the plan, system-wide shortfalls could result in widespread infection, the need for military intervention, and nearly 200 inmate deaths. And the plan shows that the department anticipates that it may need to spend more than $2 million on supplies to respond to the pandemic, including personal protective equipment, medication, and body bags.
Well, I mean, that's even worse, like if someone dies and they're not properly contained.
Yeah, they're in charge of over 22,000 inmates. But again, it's scary. Oh, it looks like someone's asking for the Zoom code. Are you looking to come on live with us? We can do that. I'm gonna text them that. Maybe we can get some people to come in and chat with us.
Yeah, or maybe just tell us what's going on in their state.
Yeah, and guys, just remember though, this gets shared out. So if your department sees it, I don't want anybody getting in trouble. But
Right.
if you want to talk, we're more than happy to have you. But again, guys, you got to be careful because if your department finds out and you don't have the permission to do that, that's why most of my people I like to get are retired or done the proper paperwork. I mean, I love to get the intel, but I need you in the field. So I'm not willing to risk that if you guys are going to lose your job. But again, if you guys are interested, let me know. Me and Connie will always be willing to talk with somebody, and then we can keep kind of the guests interchanging. I think that would be pretty cool.
Absolutely.
Hey, you sent me a good thing about Connecticut, how their numbers are going up. I read the numbers off yesterday. You didn't get anything current on that, did you?
No, I don't know there'd be any change from yesterday, but I'm assuming that there would be because that's just the nature of things. That the numbers continue to go up daily.
Yeah, there's a lot of departments now that are putting the numbers on their main webpage.
Yeah. So right now we have 21 inmates who are positive in prison. So today there were 6 more.
Oh,
I forgot. I actually wrote it down.
Yeah, because your state is Connecticut, New York, New Jersey, even start to be PA, Florida. They're considered hotspots.
Yeah. So for the state of Connecticut, we're at 6,906 cases and 206 deaths.
That's the state of Connecticut, right?
The state of Connecticut.
Let me ask you a question. What's Jersey at? Can you find that out? Or
sure, I'll look it up right now.
Jersey is high. We got to be over 40,000 right now, easily. Hey guys, you know what I've been trying to do now, and it's been happening. I've been getting a lot of family members of officers and frontline staff to come in and talk about what their concerns are. So if your state you feel is behind the the 8 ball where they're not providing protective equipment or they're just not taking the threat seriously, we could use this venue. I think if the frontline staff can't communicate, the families can. It worked pretty well when I had the wives of the New York COs on. But you have the numbers?
So New Jersey has 37,505 confirmed cases, 917 deaths, 92 recoveries.
Oh, well, unfortunately, our numbers they're still growing up. We're growing out. We're still trying to see if maybe we start to peak in the next few weeks. But I will tell you guys, these next couple of weeks, at least for Jersey, New York, it's going to be tough. We're expecting numbers to go up dramatically. I actually think, I know this may be crazy, I was sick in February. I don't know if Connie remembers that. And I was out of work for 2 weeks.
I remember. You sent me a picture with you with your mask on.
With the mask on, yeah. I was on breathing treatments and everything, and they didn't know what it was. They tested me for the flu. They said it was negative, and then they gave me something as asthmatic bronchitis. But I've never had something like that before. It was very overwhelming. I couldn't breathe. I couldn't catch my breath. At one point, I was thinking about checking myself in to a hospital just to get some breathing in. But I made it through. So hopefully maybe I had it and I passed it. But I will tell you guys one thing, that another story though too. For people that think it's not serious, man, does the temperature in the room change when you find out that someone you just talked to the day before got tested positive?
Absolutely.
The whole temperature of the room, I mean, temperature, that's jail talk, but the whole temperature of the room changes. I mean, here you are respecting these rules, but we're not perfect. And then all of a sudden you find out like, hey, maybe this person tested positive, and then the room just goes silent and everybody's they're shaken. And then you have people that are actually, but don't get me wrong, they're still doing it, but they're afraid for the first time ever to go to work. And it's funny because they're not afraid to deal with inmates. They're not afraid with the physical threat. They're afraid of this unknown. And all they ask for is to be protected. Do what you can. Go above and beyond. So right now, Connie, from a medical perspective, this is a great question. And based on those CDC guidelines that we have, what do you think right now has to be done by each facility to protect their employees? Like, this has to be done. What do you think should be done? And again, like, even if it's an extreme measure, who cares?
I think best case scenario is everyone has on protective equipment. Everyone. And I don't think it should just be your mask. I think you should have gloves. I think you should have the plastic that goes around your shoes. I think that, so I think that's for me anyway, the top of the list is everyone being able to wear protective equipment, and that not be limited to just a mask and gloves, because I don't think a mask and gloves are actually 100% effective. And then I also think that if we've identified areas that could be a hot spot, or we even suspect that someone is positive, I think that there shouldn't be a hesitation to lock down that unit, or to sort of, I don't want to say confine that person, but to somehow contain that person so that they're unable to spread. I think sometimes the challenge is that we're not always responsive proactively or quick enough. I think the sense of urgency, maybe with this, because it is a crazy situation, we may be more responsive, but sometimes I think the delay in making the decision can sometimes really create a problem.
Right. And I agree. I think that when we started knowing that this was happening, again, we should have been prevented, but we should have had preventive measures. But I think the problem I have now is maybe, the first couple of states, okay, we didn't know what we were going into, but now you do. Now if you're not doing anything to prevent, that's bullshit now. Excuse my language. Like, maybe the first couple of states, what are we walking into? You know what I mean? And now
it's that unknown. You're like, holy crap, we were the first ones to have to deal with it. But now it's here, and we know what other people are doing in order to prevent this from spreading and becoming such a situation in the facilities. But some states still aren't taking those steps.
Well, Exefio says he knows someone who works at the VA treating active COVID patients. They haven't yet issued protective gear to all staff. And Matt mentions a good point. We talk about this a lot, Matt. We talked about this yesterday too at Russ. How will a prison hold an academy with the rule of 10 or less in one setting? Let me explain something real quick. And I think Connie may be starting to see this too. A lot of states or a lot of agencies are bringing back people from retirement, both in law enforcement, police, corrections, maybe even medical. I don't know. But definitely in corrections, Jersey just signed an executive order today to bring back, law enforcement, frontline, first responders. But with the academy, now there was a talk because you saw some states that like, you know what, man, we got to cancel this academy because it's we can't respect social distancing. There's just too many. But the problem here is that we may need those numbers.
I was to say, you need those people. That's a very tough space to be in.
Right. So I think that the academies could be done in an isolated way. Yes, there has to be some physical. We'll figure that out because I don't want to minimize the complicated role that it is to be in corrections. A lot of people don't understand how hard this job is. But at this point, if you have people that are coming in because we need the numbers and we kind of maybe do like a temporary academy just to get the numbers in, and you could partner them in with somebody with experience, we may be able to balance a little something, but you have to lock down the facility. By the way, that's what I'm telling you to do. I'm not saying that when we're doing this and we're bringing in these rookies that, that don't have a lot of good training, that we're going to have facility run as normal. That's not what I'm saying. I'm saying that the facility is going to be locked down and it'll just be a set of extra eyes partnered with somebody with experience. But if you don't have that academy in play, our numbers are going to dwindle. That's why I even mentioned the two teams. Like we talked about before, you keep things locked down and you kind of exhaust Team A as best you can. And then, and I doubt, to be honest with you, if you keep things quarantined, right? So Team A has limited interaction with the public just amongst each other to and fro. All you would have to deal with now is what's going to exhaust itself out in the facilities. That's what I'm thinking. You're not going to introduce anything new. And if it hasn't happened in your facility yet, don't wait for it to get to that point. Do the lockdown and then kind of keep, hey, Team A, this is what you're going to get. Team B still gets paid. They still get paid. I'm not saying that you don't pay them, but the thing is, you're not needed yet. Let's just keep them in the facility, and then obviously if we need staff, we can pull from TB. And I think that would kind of help us go through the peak and then eventually the drop. But the thing here is that it's the lockdown. I don't understand why that is so hard, even at this point, to just say, lock it down, political pressure or not. I mean, once you eliminated the visitors, once you eliminated the volunteers, you cut down the civilian staff to the bare minimal. I mean, literally bare minimal. At that point, hey, listen, instead of doing all that, just lock it down. If they're not needed, send them out. And the funny thing is, here's what we were talking about. Me and Russ were talking about the other day, just out of curiosity. When they cut the visitors back and I guess the volunteers, they were like, well, I wonder if the contraband's still going to come up. And we still have it. Yeah, visitors aren't coming in, but we still have people getting caught with contraband. So obviously that's people are sending me messages right now, Gangi, even during this time, look at this shit. So now you have no visitors coming in. Now the contraband has to be coming in from, us, which is sad.
I'm like, did you just say that publicly, Gangi?
It's sad. Well, listen, I'm pro the family, those that respect the rules.
Absolutely.
So
absolutely.
Once you break that rule, once you bring in contraband, family of mine, I don't care what happens to you at that point because you don't have no value for my life. I don't know what that contraband is. I don't care how small.
Absolutely.
But we expected the contraband to go down, but unfortunately, there's still some contraband coming into the facility. But I thought this was a great way to test that. Like, hey guys, this is a good idea for you guys too. Since you're kind of at that bare minimum, you should see how much the percentage the contraband goes down, or is it staying steady? Because then you may be able to determine where that problem is.
I mean, and it's a good point of discussion because, when you think about what are those things that prevent sort of teamwork, right? What are those things that prevent, you and your colleagues to work better together, whether you think your colleague or, you know, a fellow officer or a fellow staff member is compromised or not, right? Like,
Right.
it's like, okay, so now now you can see, okay, well, it might not be, you know, the visitors, it might not be the volunteers, right? So maybe do we shift our thought process and not assume the worst of them who are coming in to kind of just do their job, right? Because I think that fuels the us them. And now you can see it's not us them, it's us. Like, we need to be checking each other. If we see something, we need to say something.
Right. And as I said, I hate the us versus them mentality because I realized a long time ago, especially as management, if you have an us versus them mentality, it does mess up with, I mean, let's say you have officers that have an us versus them mentality with the inmates. They also wind up having an us versus them mentality with the civilians who they see as
Yep.
advocates for the inmates. Hey, a couple of things. Tim made a very good point. I want to mention that. Tim mentioned if it hits the population, Team A will get sick also. He's 100% correct. That's why I was thinking, just to add, and Tim A, thank you, Tim, thank you for that, because you made me think a little bit, is that Team A, they would have to be home under self-quarantine. I mean, they would have to be quarantined somewhere as well, because you don't want to kind of introduce anything in the environment. So I'm sorry,
Yeah.
once you work in this profession, Team A and Team B would be, immediately near the facility, and maybe Team A could be self-quarantined with their family. And if they have to get tested before they go in, whatever it is. But the key, I think honestly, if you do it right, Team B would have enough to kind of make it through, because it would just have to go through whatever's in there has to kind of exhaust its way out. And then I think once it exhausts its way out, if you keep this plan going, there should be no way it enters the facility again,
Right.
in a perfect world. And also,
Unless, which I think is a question that hasn't been answered, that is it something that's reoccurring? I've not seen the answer to that anywhere, right? And so the only thing I see as a concern is that if we give ourselves that false sense of security, that it's flushed itself out and we shouldn't see it again, but then it flares back up for some reason because we don't know that it can or cannot reoccur, that would be the only drawback to that.
well, someone mentioned something about vaccine that eradicates coronavirus for at least a year. And I was like, oh, that's not good. You're like, I don't know. Like, what?
I'm like,
Yeah,
yeah.
it was the damn daily. Now, what's it called? The daily. I forgot. And I share that sometimes too. Hey, Matt said something good about the hours. What about running shifts for 13.33 hours, 3 days a week? Makes for shorter weeks and less staff at work during the week. Yeah, I agree. I mean, I also think that the essential employees, they're also going down to the bare minimum. So you're kind of running everything as if it's a third shift, midnight shift, where you're kind of just doing the bare essentials, keeping the inmates in their cells, keeping the inmates locked down. And a lot of people are concerned because they feel that if they keep the population locked down, oh, what about their mental well-being? What about their mental well-being with a threat in the air, that you're not making any effort? So I think honestly, I could probably think that you can balance their mental health concerns, because you have staff that can do that, that knows these inmates, that understands where those concerns originate. But what you can't do is you can't balance that unknown threat. Like, I can't balance what I can't see. So,
Yeah.
I mean, for people, I mean, Connie, from your perspective, why do you feel that people still do not want to lock down these facilities?
I think it probably is more related to just public perception, right? Like, so you guys can't figure out how to make this work. And so you always think that the answer is that you lock down. And are there other ways, more creative ways that we could be managing the population or managing the event that's taking place? And I feel like when you don't work in a facility, you have no idea what that really means. I think you could be on the outside and be like, oh, no, we can't just lock it down. Or the other way, right? Yeah, just lock it down. But like, until you work there. So what does the lockdown create? Like, from a operational perspective, are there certain disruptions that it creates? You would assume, okay, by now no one's going to school anymore. I don't know that people are still having groups. Are people still getting called out of cell for like random things that aren't essential, that aren't a necessity? I don't think that's happening, right? But the reality is that from a mental health perspective, I guess I'm thinking like long term, right? If people are in this space of lockdown and they're unable to socialize and they're unable to kind of get their rec time in and their whatever it else it is, right? Like long term mental health impact, does it exacerbate, people's current mental health diagnoses, right? What happens to that person who's already has anxiety or who's already bipolar and now they've been locked in for X amount of days? Long term, what is that impact, and can we actually manage that?
Well,
I don't know what that looks like,
yeah, but
right?
you know what's funny though? We'll come to an end, guys, soon. We just wanted to get some quick dialogue here, but I just want to add something too. Like right now, everybody's looking at, what we provide the population, privileges versus rights.
Right.
And I think what's going on now is that when you change these privileges over to rights, when we make an effort that is needed for safety and security, the population or the family starts fighting it because they say, well, now you're affecting their rights to go to rec. You're affecting their rights to, leave their cell and do. It's like, yeah, but they should never be rights to begin with. These should be privileges that they earned. And now that we need to go back and implement a higher level of security for preventive measures, they look at it as being punitive because you're taking away a right. It's not.
But it's not a right.
It's not. I'm trying to protect. So I think that what we need to do now is, yes, we definitely need to lock it down. But I think people in these higher positions should be like the legislators, the senators. They should be there. The politicians, let's just say, they should be there to be that buffer to explain why the lockdown is necessary, so the facilities themselves aren't overwhelmed with these ridiculous phone calls as to why are you locking them down? What do you mean why? It's like, if you don't, first off, the community's locked down, so hello. But second thing is that they have two options. The community wants two options. The one thing is they don't want their family members locked down. They want them to still maybe roam around, which is crazy, or they want them to be released automatically. Yeah. Both is in opposition of what we really want to do, because one is really not a safety for the community, and the other thing is really not a safety for us. If they could just let us do what needs to be done and really start looking at, okay, well, you may think it's punitive, but this is why it's preventive. I really do think there'll be a lot of people, including inmates, that actually would say, lock us down. Why is I would bet you there's inmates right now policing their cellmates, saying, don't go out, because I'm with you, because we can't social distance inside a prison. We all know that. So I would assume that, you may have an inmate telling his cellmate, don't go out today. Am I lying?
No, you're right.
I could assume that happened. Like if I was in a cell with an inmate, I'd be like, hey, listen, it's us, me and you right now, because we're stuck.
And you're not bringing nothing in here.
Right. And what's funny too is there's a lot of facilities that are now also limiting the in-house unit moves. Because they don't know if you have one unit that's not affected, and now I move this guy for whatever reason, unless it's a safety and security concern. But you may talk about every move may require some form of isolation, because you may have a unit that's within the facility. We talked about facilities being hotspots. You may have a unit in a facility that's a hotspot.
Yeah, absolutely.
So you want to keep that localized. And one last thought. Let me ask you one last thought, and we'll kind of come to a closing. But and I know you mentioned it earlier today, but definitely believe right now at this point, because we kind of went back and forth with this, that inmates should also be given masks.
Yeah. I mean, at this point, like, everyone wants to be protected. And even if it's not just a matter of keeping people's mental health intact, because the fact that I don't have a mask on and other people do, perception becomes reality. Are all these people sick, or am I just the only one who's going to get sick because I don't have anything that's protecting me?
Right. And I'll tell you something right now, it's going to get hard to get inmates to volunteer for certain jobs, like, working with in areas that could possibly be affected. So you really have to protect those inmates. And if they choose not to do it, most likely you'll find inmates that will do it. But I don't know if you want to force them, because God forbid they get sick, that's going to be tough. I mean, yes, we do
Or
have.
God forbid you send them to go work. They said they did the work and the area is still contaminated because they didn't really do it. Because
Yes,
they didn't want to get exposed, you know?
yeah, I agree. You want to get those inmates trained right now, right? Wear the
Yep.
protective gear and let them
Yep.
see. And be honest with you, there are going to be inmates that are going to step up and, want to do it. But if you have inmates that don't want to do it, you don't
Hmm.
want to force them because they're telling somebody on the outside that, hey, they're forcing me to do this job. I'm uncomfortable with it. I'm not 100% going to do it. And now if something happens to that inmate,
Absolutely.
the agency is going to be held responsible. Um,
Oh God.
these are just, things that are happening on a daily basis right now.
Yeah, that's the nature of it.
Well, Connie, do you have anything to say before we close?
Um, the only thing I just want to make sure people do, I mean, as much as we talked about hand hygiene, just, even though you may have hand sanitizer, soap and water are always the best option. Please just keep hand hygiene, keep your hands clean as much as you can, away from your face, eyes, nose, mouth, all that goodness. And just maintaining some cleanliness of those high touch areas, whether it's your home, your car, whatever, anything you can do in order to make sure you stay safe and you stay healthy.
Yeah, and guys, by the way, I'm going to try to have someone on the next couple of days that's, excuse me, is going to teach us how to make the mask from in-home products. Hey, a lot of people are actually using coffee filters. They're putting the mask on and they're putting coffee filters in between the mask and their face, some form of filter. But Shelly Addison's been really doing well. I posted a picture of the stuff that she's been putting up there. She's going to show me how she makes them because obviously she's been making them for her CERT team. She can't make it for everybody. So we figured we'll teach somebody how to fish. Instead of providing you with the fish, we'll teach you how to fish. And maybe that's something that we could share along. But I'd always, guy, we're doing these shows because we think of you. Don't forget at Lexipol, they have information on policies that are in compliance with CDC. So you can go ahead and make sure you're following those. If you see any ideas from here, take it up. I mean, we're going through it right now. So we're able to give out some information. Some you may have heard on prior shows, but let's keep it going because so far these practices seem to be working. And yes, we're reacting, but I promise you we'll make it through. And for the facilities that it hasn't happened, don't wait to react, prevent. And again, I'm going to say this in every episode, just lock it down. Just lock it down. Sorry. It's true. As always, guys, love you guys. Stay safe. And it always takes me a while to disconnect. So I may just wind up cutting myself off. But hold on one second.